Last week after a workout, I was doing some stretching like I always do, but something was a little bit different this time. I felt more restricted than usual on my mastectomy surgery side, and I was kind of curious as to what was up. So I went over to the mirror, lifted up my armpit, and there it was, a cord. Cording isn't something that I knew that I was supposed to watch out for post breast cancer surgery, and even now, years later. So today I'd like to share with you what my cord looks like and some background information on it, as well as what to do for treatment to alleviate it if you happen to have this experience as well. My first experience with cording was after my mastectomy surgery in early 2019. It was right here, right about where your bra strap would be, and I found that it was extremely tight, and I had no idea what it was because I wasn't given the heads up about cording. So I was talking with another breast cancer survivor, and she mentioned, "Have you looked into cording?" Which I hadn't. So I did a Google search, and I'll just read off what I found there. Cording, or axillary web syndrome, is usually a side effect that occurs after surgery to remove a sentinel lymph node or multiple lymph nodes from the area of your underarm, which is a common practice for breast cancer surgery. And that is exactly what I had done. It goes on to say, it can also be caused by scar tissue created during the surgery in the chest area without the removal of any lymph nodes. Cording can appear days, weeks, or months after your surgery. Something that I find really interesting about the Google search that I did is that it doesn't say anything about cording recurring years later. They say days, weeks, or months after surgery, but now I am more than 2 years out from surgery and I've had another recurrence. And this is actually my 4th time having cording. So the first time, as I mentioned, was in 2019 after my mastectomy surgery. It was mostly right here. The second time I had cording, it was when I was finishing my radiation treatment. And the interesting thing is, at that time, I was starting to really focus on building back the muscle that I had lost during all of my active treatment. And I got it in my armpit, and it actually came a little bit down my arm. I could feel it down here as well. Then it went away. Then I had my second flare-up after my second breast cancer surgery, and that was in 2020. Once again, I had it in my armpit, and then it went away. And then now the 4th time, coming back again in 2021, in my armpit again. And the interesting thing is, for the last couple months, I have been working once again, focusing on building muscle, and then it shows up again. So I'm kind of interested to know, first of all, why the recurrence over the years? And second of all, is there a correlation between building muscle and cording or not? So in the past 2 years, I have had a flare-up of cording 4 times with complete recovery in between each of those times. Research has shown that there is a correlation between breast surgery and cording, but I haven't been able to find anything that supports my hunch that there is a correlation between increasing muscle mass and recurrence of cording. So I'm kind of curious if you've experienced cording or flare-ups over the years. Have you noticed anything that you think might trigger it? Even if there is a correlation between cording and building muscle, which I don't know that there is, I'm gonna keep on doing what I'm doing because building muscle makes me stronger on the inside and the out. It improves my quality of life, and I believe it'll improve my longevity as well. So I'm not going to change what I'm doing because I'm having a flare up of the cording. It doesn't affect my life that much. I'm going to treat it and it's going to go away, and I'm going to continue to support my body in getting stronger. To me, the cord looks like a really tight tendon that is protruding from the skin. I'll show you mine in a minute. Right here, I could see it jutting out. It looks like there's strings in there. Someone's pulling it really taut and it pops out. I can see them there. I could see them in my armpit. When I had the cord that extended from my armpit down into my upper arm, I couldn't see that one at all. I could feel it. But the thing that was really interesting is when I turned my arm, just like this, it was like it had a pucker spot here that was pinned to the cord and the skin wouldn't move like I wanted it to. Like you can see there's no puckering happening here. So I thought that was really interesting. So as a heads up, I'm going to show you my armpit in a couple seconds here. If you don't want to see my armpit, look away temporarily, but I want to show you what it looks like. Come in close here. So right here, that is the cord. So it's really tight and protruding. So just for comparison, on this side, I don't have anything there sticking out, but on this side, got to get the lighting just right. Coming closer here. See right here, that's the cord that I'm talking about, that I'm working with right now. So, and it stuck out when I had it right here. I don't have it right now, but it stuck out just like those strings did on my armpit, and you could see it as well. I hope that helps you. I find the feel of it a little bit harder to put into words because when I'm sitting here right now, I actually don't feel the cord in my armpit at all. I can feel it being restricted when I go like this. I can feel it with my finger when I go like this. So if I do this, it is very hard. It does feel like a hard structure within my arm. I feel like if I were to push on it, it could snap. But as for pain felt within my body, this one isn't giving me that. These ones were a bit more painful, and when I had the one that extended from my arm going into my armpit, going into my arm, I found that that was more painful and it felt deep, like I couldn't massage it out. There was something in there that was uncomfortable. But on a scale of 1 to 10 pain rating, I would say 2 to 3. Like it wasn't really painful for me. It's more just an annoyance. I know that it's there. I know that something isn't right and I want to fix it. Stretching is my first go-to for relief. As I mentioned, the area feels tight and restricted, so spending extra time stretching it out just helps open up my shoulders again and helps alleviate that pressure that I have where the cord is. Another thing that I find helpful with stretching is finding a stretching video because I get distracted during stretching and I think that I'm holding it for a long time, but I'm actually not. So following along a video helps me stay focused and on task. The next thing I would recommend is making an appointment with a specialist. This person could be a registered massage therapist, an occupational therapist, a physical therapist, or a physiotherapist. See if anyone has any specialized education in breast health or post-surgery care. You could also look into a specialist of lymphatic drainage. I felt very lucky to connect with a physiotherapist in our town who has had experience with alleviating cording and who is actually now collaborating with another practitioner to do a little bit of digging to learn more about cording. So if I get some of the inside scoop, some of the latest information, I will make sure to pass it along to you. In my experience, the purpose of the treatment is to break up those cords so that the lymph can flow freely again. So in the treatment I've had, it almost feels like the skin is burning, not like fire burning, but you know, when something is creating friction, it produces that hot feeling on your skin. It feels like, yeah, hot friction. It's the best way to describe it. But the really interesting thing is when he is successful in alleviating that cord, you can actually hear like a pop or a snap. And that is the sign to me that I know that is working and I'm going to feel like instantaneous relief. So I think that's really cool. There isn't a lot of conclusive research explaining exactly what cording is, why some people get it and others don't, and why, like in my case, it can return a couple years later. However, now that you are aware of it, I hope this gives you some insight into what to watch for yourself, as well as a little bit of peace of mind knowing that you can get rid of it with a little bit of tender, loving care. If there's a specific treatment, topic, or breast cancer insight that you would like some information on in relation to my journey and how it can help you, please put it in the comments below, as my sole purpose of sharing this content is to support you on your journey. I'm going to leave it there for today, as I don't know if you can hear it, but someone has decided to start attacking their lawn out there with some very loud machinery. So thank you so much for being here with me today. If you enjoyed this video, I would greatly appreciate if you would like it and if you would subscribe to this channel. The more people who are subscribed just pushes the content out a little bit more so that we can reach more people. Thank you again. Have the most wonderful day, and we'll see you next time.